Go.
So we're going to be talking about how to fit assistive devices. So the most common one that you're going to use with a patient, and which is seen on most floors, is going to be our rolling walker. We do have standard walkers on the floor, so those are ones that do not have wheels on the front. We typically like to say that those are kind of the bane of our existence as PTs here, because if a patient has to lift that up, they're at a higher risk for falls. So typically we are utilizing rolling walkers for this. When looking at a walker to figure out if it's positioned correctly, the major thing that you should think about is kind of thinking if you have a wristwatch on. Your wristwatch should be right about at your hip joint, and then you should have about a 20 to 30 degree bend in your arm when you're utilizing a walker. With putting your hands there, the walker, your hands go right on the gray grips here. You never want to have a patient press down on these buttons because it will collapse the walker. And conversely, whenever you open the walker, you have to make sure you actually hear the click so that it's safe and the patient won't have the walker collapse on them. It's very easy to change the height of the walker. You just use these button knobs down here. And again, it dictates on that degree bend in your arm. So if you take it up, the major thing to be aware of though is having all of these aligned in the same pattern. You don't want the walker to be off kilter for the patient. Another thing too is making sure that you don't put this on the ground, because again, then the patient's hands will be directly touching the ground, which we do not want them touching a hospital surface for that. The other important thing when sizing a walker is making sure that the height is appropriate. If the walker is too high, you're going to end up hiking up their shoulders. That can create neck pain, and it can also create an impingement on their brachial plexus, those bundle of nerves underneath their armpit. If it's too low, then the patient's going to end up leaning too far forward, again causing neck and back pain, which are things that we don't want for the patient. Conversely, if we move over to a crutch, it's very similar in how you set it up. These do make it a little bit easier because they actually have the heights written on them. However, they're not always exactly accurate, but you can utilize that as a guiding force to help do it. Again, it's the same button push, goes in. You can also tighten and move the hand grip up and down as well. And the thing that you need to make sure most with the crutch is that you have 2 fingers underneath your armpit in the crutch. Again, that's to not impinge the brachial plexus up in here, because we don't want to create any injury with that. So that's all we have for how to fit these assistive devices, and we will be on the floors to talk to you guys and help you with that if needed.